The City of Nanaimo's community safety officers now have 3 new responder vehicles to better assist unsheltered residents. This upgrade was made possible through a $442,000 contribution from Health Canada's Emergency Treatment Fund.
So this is one of our new fleet vehicles. It's a 2025 Ford Lightning that we acquired through federal funding that we got under the overdose prevention stuff that's going on in our province. We hope to have this vehicle to help us deal with overdoses that we come across in the community. We do hand out a lot of naloxone to those that are the sleeping rough on the street, and we do administer a lot of naloxone too. So it's important that we're fully stocked. These vehicles are different from our other vehicle in terms that we can now run red and whites. When we used our other vehicles, we only had amber. So if we're dealing with an overdose, especially in the evening, and we're calling 911 or calling fire, they weren't always able to sort of identify where we were at. So it's pretty easy for them to be able to find us quickly, especially when we're in more of a remote area. Most of the cases that we'd be doing this, it would be obviously an overdose. These vehicles being outfitted with oxygen, AEDs, and just the lighting system alone allows us to be more visible, allows us to respond in a more effective manner, because not all overdoses require naloxone, but they do require oxygen. So airways are extremely important to make sure that it's there. Having the AED, if we get into a situation where cardiac arrest does happen, and we have a slow response from our community partners and paramedics and fire. It just allows us that extra time that we can give care to that person that we're dealing with. So just makes us just that much more effective, considering the amount of overdoses that we respond to. Because we are 7 days a week, and giving that 18 hours of coverage, we are the team that's out there on foot, dealing mostly with a lot of these people that are sleeping rough in the community. So it's that more robust response to overdoses that's very much needed in the community for sure.